Dr. Sriram Sawariker is currently working as Vice Chancellor, Gujarat Ayurved University, Jamnagar. He's a teacher with tremendous reputation for about 23 years. He also is an able administrator in various capacities, like Advisor, Department of ISMNH, Dean of Government Ayurved College, Usmanabad, Dean of Faculty of Ayurved, MUHS, and the list is a huge one. He has been nominated for various responsibilities like member of the Scientific Advisory Committee, CCRAS, member of the Task Force of Planning Commission on ISM Education for 11th Five-Year Plan. He has been accorded with countless honors and felicitations. He has a book titled Vaidyakiya Sankhiki Shastra and more than 100 research articles to his credit. His topic today is Ayurveda education, where we stand and where we go. May I request Dr. Sriram Sawariker to begin his speech.
Namami dhanvantari devam surasura vanditam pada padmam loke zaraluk bhayamrityunasham data ramisham vividaushadhinam. Honorable Chairman, Mr. Sitaraman, my co-speakers on the dais, dignitaries in the audience, Ayurveda lovers, students, Ayurveda education, where we stand, where we go, the topic which I will be covering today. In fact, 15 minutes is a too short time to cover this topic. But still, I would like to highlight some of the important issues which will be deciding the future of Ayurveda. Some of you might be aware that in the next week only, there will be a consultation, WHO consultation, which is going to be held in Milan from 20 to 24, where the general course, the future course of traditional medicine will be decided regarding the training as well as the safety of traditional medicines. Ayurveda is one of the important of those traditional medicines. This is the right time to discuss all these things, friends. Yesterday, when I was traveling, I just read one news item. The news item was regarding one recently carried out research in UK by Warwick University. The research was related to the newborn, 1-year-old newborn, the effect of massage on the newborns. And the 600 children were examined, included in the research study, and it was found that the massage is very effective in relieving the stress of the children as well as building his general health. Not only that, compared to these children who did not receive the massage, their health is good, as well as the postnatal physical status of the mother, physical as well as mental status of the mother is very good when she herself gives a massage to her child. And that is why it is important that the massage should be practiced. You all know, my friends, in India, every mother gives a very good massage to her old child. Only the westernized mind does not allow it to do so. But now I hope so that we will understand that, okay, now the Westerners are doing these things, so it's okay. That is the general state of our mind. Friends, these are the few experts from National Health Policy, 93 as well as 2002. How do we look to our education and what our education system has given us today? The picture is very clear, my friends. We have a very good infrastructure of Ayurveda spread throughout the country. Number of hospitals, number of dispensaries, RMPs, registered medical practitioners, twice the number of the LPIs, separate departments established in 1995. But what is the result? The result is ISMNH has not been able to play a significant role in healthcare delivery services for want of legitimate involvement in public health programs. I am not quoting myself, I am quoting a government document, a policy document. So, what is going wrong? We have almost 250 Ayurved colleges spread in the country. More than 50 years have passed since we have begun the institutional educations. Establishment of council, 30 years have passed. But what is the result? These statements in the presentation are general observation, my friend. Don't take it personally. Maybe it may be hurting somebody, but I don't mean any personal attacks. These are the general observations. They are not applicable to any individuals at all. Our main worry is general Ayurvedic practitioners. I request all of you to go through my guest editorial from the Sanjeevani Times, which will be distributed to you. The main worry is the general Ayurvedic practitioner, which is becoming a rare commodity as the time is passing. We are seeing that the Ayurveda is being globalized. It has been spreading throughout the world. But in this rush, we are losing a genuine Ayurvedic practitioner. I'm talking about the genuine practitioners. Who should be a genuine practitioner? Sushruta says, he who is learned only in theory, but not skilled in practice, gets confused at the approach of the patient, just as a weak-hearted person is confronted when facing a battle. The condition of our students or the practitioners is just like that. The problem is in education system in India. It's not only concerned with Ayurveda. In fact, our whole education system is a little bit in a doldrum. Danger of soon becoming irrelevant. Mode of teaching becoming outdated. Examination system unproductive. I will be catching on all these points as the time permits. What is the problem with the medical education, overall medical education in India? It's a British legacy which we are carrying. In the education field, we are carrying the British legacy, which was only meant to produce the clerks, not the scientists, or not the experts. If you want to become experts in those days, the people were supposed to visit London or Western countries to get the expertise. So this system was meant to prepare clerks who were able to serve the Britishers. But still we are carrying on the same system. That is the main worry, friends. That's why it fails to fulfill our aspirations and expectations, particularly of rural people of India. We say that 80% of the people of India are staying in rural areas. Still we are not addressing their issues. For Ayurveda, the pattern does not suit the system. See our syllabus. The syllabus is a total replica of modern medicine. It is not conducive to the Ayurvedic system of medicine. We have to give a serious thought to that. So, the general medical education is didactic and theory-based, more information imparting than the problem-solving, examination-oriented, sequestration from and lack of integration of preclinical and clinical subjects. I will just run through all these things because they will waste more time. I want to concentrate more on other points. This is Edinburgh Declaration. It's also far away from the Edinburgh Declaration regarding medical education. To produce health professionals who will promote health of all the people, not a particular strata of people. The diseases which today we are concentrating, diabetes, cancer, cardiac problems, obesity, all the diseases are related to the higher strata of the people. Comparatively, I'm not saying that they are not seen in the lower strata. But we are concentrating, but what are our main problems, the rural people problems? We are still not able to supply pure, clear water to our people. We are not able to basic primary education. We are not able to treat their diarrhea, dysentery, simple things, fever, digestive problems. We are not able to treat them. Still, we are trying to concentrate. These are the Western problems. They have their problems, big problems, diabetes, obesity, chronic diseases, etc., etc. We have many little problems which we are not able to address. We should concentrate on that. So promote health of all the people, affirm to the health needs of human race as a whole and whole person. Shift training from passive to active learning. Our training is a passive training. We should shift to the active learning, my friends. Maximum time of our students should be spent with the patients. I propose, recently in the task force also I propose that our clinical training should start from first year itself. I learned that some of the colleges are conducting clinical training from third year onwards. Even though council describes that 26 months clinical training is required, but most of the colleges in our country, they are giving only 12 months training, that too a very short training. The clinical training is the main thing. We are all considering theory-based learning. What is left in theory? It should be practically oriented. Give them most of the time. They should spend most of their time in hospitals only. We don't have beds. Even though you have beds, they are vacant. Only 20%, 30% are there. What the student will learn? That is the main problem, sir. That is why shift passive training to the active training. The present medication is away from the spirit of Edinburgh Declaration. The general also. This particular statement has come keeping in mind the modern medicine. But it is applicable to Ayurveda also. If the modern medicine is away from this declaration, what will be the situation of Ayurveda? Still, we want to stick to that system only. Friends, types of doctor needed. These are the types of doctor needed. 60 to 70% family physicians are needed. Rural surgeons are 20 to 25% needed. Specialists and super specialists care, 20% is needed. This is a statement given by Dr. Rajshekharan. Bohra committee also attempts to produce basic doctors or community physicians through reorientation of medical curriculum. Primary objectives of medical education, what should be? To support the health development of the nation, community-oriented and not individual-oriented, should be based on priority of medical care. Medical education and healthcare to be linked. They are to be linked. Medical education is for practicing. It is not just for giving lectures, delivering the sermons. You don't have to deliver the sermon. You are learning medical education for practicing, not giving the sermons. We are wandering here and there, giving lectures. I am giving you a lecture on the coming on the dais. People are inviting me. But if I am not able to practice it, what I speak, it's useless. My talk will be useless if I am not able to practice my talk. Greater emphasis should be solving on clinical problems. Solve the clinical problems. That's most important, friends. End products should be able to assess and improve the quality of healthcare, making optimal use of new technology. We are running for new technology. We want to use new technology, this USG, this thing, that thing. You don't need, you think, that is a need, definitely. They are very important. But for basic thing, in our days, our teacher used to say, you first diagnose the patient clinically. You spend much of your time with the patient, clinically diagnose it. And for confirmation of clinical diagnosis, you go for the investigations. Now we are relying on the investigations first, and then we are going for. We are giving minimum time to the patient. That's the most worrying system. And in Ayurveda, at least, you should spend at least half an hour with your patient every time whenever the patient visits to you. You don't depend on the investigation. You have to correlate the investigations with your clinical findings and not the investigations with the clinical findings. That's not right. So, promote healthy lifestyle, work efficiency in teams, manage organizations by himself. Objectives of the policy, these are the objectives. You can see these objectives are not fulfilled, my friends. Ayurveda, UG education. What is the status of UG education? These are the aims and objects of the CCIM has declared. Their syllabus, they have given these objectives. Whether these objectives are fulfilled, you just go through it. They are not. Teachers' objective, not fulfilled. We are not producing good teachers. We are not producing good research workers. We are not producing good chikitsaks. We are not producing good surgeons. There are a very respectable expression. I salute them who are very good teachers, good physicians, good surgeons. I salute them. But they can be counted on fingers. We want them in thousands. But no, they can be counted on fingers only. That is the main. So that means our education policy, our syllabus policy has been a total failure, my friends. Objectives should be what should be. In fact, the objectives are not correct. For undergraduate education, you don't have to produce a teacher. You have to produce a physician. The teacher or expert is to be produced in postgraduate education. We have to produce a simple physician or a person who is able to take the postgraduate education. That should be our objective. This was the objective which was set long year back. Now at least we have postgraduate education. So our objective should be to produce a physician and a person who is able to take up the further education. That should be the policy. So to produce a general practitioner for Ayurveda, to produce an Ayurveda physician, and to produce a graduate who is able to undertake postgraduate studies in the Ayurveda subjects. Academic functioning, completely exam-oriented just now. It is totally exam-oriented. You are forgetting about the knowledge. To get through the examination, that is the only, and there are so many means to get through the examination. You don't have to read the books for getting through the examinations. Theoretical stress on non-clinical part, even for clinical subjects also we are giving non-clinical theoretical part. Then practical training, very poor, no stress on individual practice training, demonstrative in nature, absence of clinical material, mostly OPD oriented. Clinical matters, measures to improve the bed occupancy, incentives to teaching faculty, additional monetary benefits. I propose that at least for our teachers who will increase the bed occupancy, whose OPD is very good, we should give them some incentives. Maybe some additional increments or additional benefits, whatever it may be, at least for that, by that means, we are able to increase our IPDs. It's a wrong feeling that we don't need IPDs for Ayurveda. People are saying, no, only OPDs are needed. No, it's not like that. We need IPD, my friends, because the IPD patient is only available for the examination, for the education purpose. OPD patient is not available to our students. Establishment of satellite clinics also to just get the drain of the patients, not to increase the number of OPDs. Clinical posting, just I have talked about that. Propose ideally, clinical posting should be from first professional year. Curriculum. How is the curriculum? About the curriculum, T.S. Eliot has said, where is the wisdom? Wisdom. We have lost it in knowledge. Where is the knowledge? We have lost it in information. So we are just giving the information. We are not giving any wisdom. We are not giving any knowledge. That's why we are losing our wisdom, my friends. Curriculum, today's curriculum is totally obsolete. Major drawback, the development of Ayurveda. We are not thinking about development of Ayurveda. It is a replica of modern medicine. They have anatomy, we have Sharir Rachana. They have physiology, we have Sharir Kriya. They have pathology, we have Vikriti Vidyan. My friends, I can't understand this. Why you are deciding that? Our requirements are different. Our main object is to produce a very good physician. The need is an Ayurvedic physician, my friends. Surgeons are produced by others. Forget about that. Our surgery is a limited thing. I don't say that you don't produce surgeons. But our main object should be to produce a good Kai Chikitsak. Our main strength, I will say. That is our main strength. Concentrate on that. That's very important. Structure, unimaginative, loaded with unnecessary teaching material. Too much makes load of subject. I will show you mark load and the subject load. And too much repetition. Blind translation of modern medicine subjects in vernacular languages. For example, triceps is 3 Srayu. Like that, there are translations. Faculty not qualified to teach modern medicine subjects, even though modern subjects are there. Classes subject never reviewed. I will skip this. Comparison of it. This is very important, my friends. Now we are replicating the modern medicine. Now what is this situation of modern medicine curriculum? See, what is the situation in Ayurveda? We are actually harassing our students. We are doing an injustice to our students, my friend. I am very serious about that. As a vice chancellor, I am talking this. I am very much worried. My students is overloaded, overstressed, and after this also, he is not getting anything. Number of subjects, there are only 3 subjects, while we have 6 subjects. We have 6 subjects, they have 3 subjects. We have 6 theory papers and 6 subjects and 10, they have 6 subjects, we have 10. Sorry, they have theory papers, 6 theory papers, we have 10 theory papers. Remember well. What is the marks for theory? They have to appear for 300 marks theory. Only 300 marks theory. While our students are appearing for 1,000 mark theory. Then marks for oral, they have 60. We don't have any marks calculated. They are included in the practical marks. They have practical for 120 marks. We have 450 mark oral. The internal assessment 120. There is no internal assessment except the MHS. Please. Okay. So this is the thing. Generally, 600 marks first MBBS is there, whereas we have 1,450 marks. How much mark load and subject load we are putting, my friends? Just remember, this is the condition of the first year. Similarly, regarding the second MBBS and the second BMS, second MBBS, they have 550 marks papers, whereas we have 1,650 marks. While third MBBS and third MBBS is split in 2 parts. They have one part 400, second part 800, 900. We have 1,850 marks of the examination. So you can just compare how much load we are having. The big load on our students. The period is the same. Load is too much. We have to reconsider. There is a repetition of subjects. Unnecessary material has been added. And it's more and more theoretical. We have to take a serious reconsideration about this particular syllabus, my friend. PG education also. My friends, I will not spend much time. PG education is also on the same lines. We are just going on adding specialties and specialties who are not existent in Ayurveda at all. Anesthesia, X-ray, etc., etc. My friends, I can't understand these things. I can't understand. I know that we should be able to do all these things. But what is our main strength? we are losing our strengths, and we are losing our courage also. These are the objectives. I will not go through this. Pharmacy, a little 2-3 points on pharmacy also. Now, I am not ready to, my industrial friends are always angry with me. This time also they will be angry with me. I am not ready to say our industry is an Ayurveda industry. It is an FMCG industry, fast-moving consumer goods industry. It is not drug industry. They say, this is the statement I'm giving you from rightly downloaded from the site, their own site. One of the things, a dozen companies for decades are existing, $1 million for more than a year. Fast-moving consumer goods items are produced, foods, beverages, other than Ayurvedic medicinal medicine. Neglected sector. This is a statement from Dabur India. I have downloaded from their website. So this is a public material. It's not a confidential. So you can see about $650 million, a fraction of Ayurvedic medicines. And last year, 15% of sales were related to pharmaceuticals. 15%. 85% products were FMCG products. Still, we are saying that it is a drug industry, Ayurvedic drug industry. I am not able to understand all this thing. See, this is the position. The Baidyanath is also the same. So lastly, I will just like to remind you, my friends, words from our Honorable President, Dr. Abdul Kalam. We need an indomitable spirit and courage to face and learn from our failures to succeed in any mission. And from Upanishad, I want to tell you, you are what your deep driving desire is. As your desire is, so is your will. As your will is, so is your deed. And as your deed is, so is your destiny in 5 senses. So don't leave everything to destiny. Work for it. Thank you very much.